From United Nations Television, this is UN in Action.
Cholera is one of the oldest known diseases which has been responsible for millions of fatalities. Recently, it has resurfaced, claiming more lives, says Sanjay Wijesekera of UNICEF.
Global trends are that the numbers are growing, and we have about 100 to 120,000 deaths a year in about 3 to 5 million cases.
Though no longer a health concern in Europe and North America, the deadly disease still affects the most vulnerable communities in developing countries. UNICEF Chief of Health, Miki Chopra.
Cholera is reflective of poor housing conditions, particularly reflective of the lack of sanitation and of poor hygiene behavior, as well as malnutrition.
A bacterial infection of the intestine, cholera is transmitted by contaminated food or water. If it progresses without medical intervention, severe dehydration can be fatal. But the disease is easily treatable. Oral rehydration therapy, or ORT, is safe and easy to administer. Yet so many people are dying due to difficulties in accessing treatment quickly. Within hours, a patient's symptoms can reach such an advanced stage that death is inevitable. Now the emergence of cholera is threatening South Sudan, putting thousands of lives at risk in the capital city, Juba. Officials fear that the outbreak will spread to the rural areas of the country as well. The infection is due to overcrowding of camps amid ongoing conflicts and the onset of the rainy season. In response, UNICEF has established a cholera treatment center at the Juba Teaching Hospital. It has also provided life-saving supplies, including medicines, protective gear and equipment, and is now expanding preventive measures to halt further spread across the country. So far, UNICEF has spent $1.7 million on treatment methods, but it urgently needs an additional $10 million to effectively contain the disease. Meanwhile, people continue to suffer the effects of the pandemic. This report was produced by Grace Barrett for the United Nations.